The other issue, I mean, in addition, obviously it's a horrible thing to have epilepsy and to not know if you're going to have a seizure that day or that week or on your way to work or while crossing the street. But there's a big cost to society in terms of a dollar cost. This is one estimate that's widely quoted, that's been published. These are US numbers because they have some sort of insurance claim data, but about $12.5 billion a year to take care of everybody with seizures. Now this we'll just stray a little bit from the scientific part, and we're going to talk about how do you decide what something costs. For example, how much does it cost to go to medical school? Well, you get a bill with your tuition. It's like $1 million a year, so that's your tuition. So that would be what we call a direct cost, right? But then there's indirect costs. So the indirect costs might be your uniforms, or what you have to eat, or how much coffee you have to drink in order to study. So those are things that are harder to measure. So when we talk about epilepsy costs, we have direct costs. So obviously the testing, hospitalization, EEG, blood tests, the cost of the medications. But then there are indirect costs about disability, you can't work, or maybe you can work but you can't really do the job that you want to do because you can't drive, so you can't get there, so you take a job that's maybe a lesser job that's closer to your house. So these are two big categories. So when we talk about what does something cost, there's a direct measurable cost, and then there's an indirect cost. And it's important because in epilepsy, often the indirect costs are actually bigger than the direct costs in terms of the person, but they're harder to measure. These are just some more examples. And then sometimes it's very hard to actually sort it out. So when you read a paper and they talk about direct costs or indirect costs or total costs, so if someone has a seizure and they go to the emergency room, then the bill for that seizure and the evaluation would obviously be a direct cost. So, but what would happen if they broke their arm during that seizure? Then the fixing the arm would be part of that direct cost. But what would happen if they come back 2 weeks later and then the arm is infected? So they have to have antibiotics for the arm. Now, is that still a direct cost of the epileptic seizure, or now is that an indirect cost, and how do you? So for people who are interested in this kind of accounting, it's not always that clear how to separate these things. There's no correct answer to that, by the way. I'm interested in it because I was able to do some research on this, and so we're going to get to that. So a guy named Dr. Fountain, Nathan Fountain, who's a friend of mine, he came up with it costs about $11,000 a year in direct costs and $3,000 in indirect to have epilepsy. In my work, we came up with a similar number where we had large groups of patients and we compared those who were otherwise well, who were in the same sort of age group and sex, to those who had epilepsy. And the ones who had epilepsy cost about $8,000 more than the ones who didn't, for whatever, for the infections, for all of their health care. The other thing that's interesting is that the ones whose, most people with epilepsy, if you treat them properly with the right diagnosis and you choose the right treatment for their seizure type, most people, about 3/4, you can control the seizures and make them stop. But about 1/4 of them to 1/3 you can't. And of course, those are the ones who contribute most to the cost. So 75% of the total healthcare bill for epilepsy is actually based on about 30% of the patients. So this is the work that I did, and you can see on the left, you don't have to read the numbers. The ones that have epilepsy cost more than the ones that don't. That took 2 years to figure out. Well, the other problem with epilepsy, and I alluded to this earlier about seizure disorder, is that there is a stigma to people having epilepsy. You know, if you're in the provinces, there's a, you know, why did that person have a seizure? Are they, you know, possessed?